Hepatitis B, making Kenya a hepatitis endemic region, according to the World Health Organization. And as the world marks this year's World Hepatitis Day, Kenyans have been encouraged to get tested for these infections, as our medical correspondent, Dr. Mercy Korir, now reports.
The 28th day of July is marked as World Hepatitis Day, a day to look at conditions that cause inflammation of the liver, hepatitis. Viral hepatitis A, B and C are the most common. We meet Boniface Ndirangu, a man who has had chronic hepatitis C for more than 10 years.
After testing for HIV, there was one of those tests that I had done that was positive, and it read hepatitis C. Well, I didn't know what it meant. Between the years 1995 and 8 years, I was a heroin addict. And a heroin addict, I shared needles sometimes.
Hepatitis B and C are transmitted through contact with infected blood. Injecting drug users like Boniface was are at high risk. Mothers can also transmit the diseases to their babies during birth. For hepatitis B, unprotected sexual intercourse with an infected partner puts one at risk of the infection. Hepatitis A is commonly spread by eating food or drink contaminated with stool of a person infected with hepatitis A.
I think many people know about HIV tests, but don't know about hepatitis B and hepatitis C and the co-occurring disorders. Many of the people that I used with, or the quorum that I was with, had hepatitis C, and some of them HIV. And hepatitis C is almost 90%.
The symptoms associated with hepatitis include jaundice, that is yellowing of eyes and skin, fever, abdominal pain, fatigue, and muscle or joint aches. Access to treatment of chronic hepatitis C is often a big challenge.
The time they declared that the medication for it was at $1,000 per tablet, and you need about 84 or 100 of them. So that means about 10 million Kenya shillings. I could not afford it. I started hearing that there is a program around in Kenya to help people who have hepatitis C access the medication for free. So I signed up an MDM program in Kangemi, and I'm just finishing my treatment.
Vaccines exist for both hepatitis A and B, but not for hepatitis C. Prevention is often advised, especially for the people at high risk. Boniface is a relieved man.
That's 13 years of knowing I have hepatitis C, and it will kill me someday. According to my mind, I knew it was going to kill me. Yeah. So I'm so grateful, man. I have a chance now that we have medication.
Hepatitis C can be cured within 2 to 3 months, preventing complications like liver cirrhosis and cancer, or even death. Having learned from his experience, Boniface Ndirangu had a message for recovering drug users.
I know quite a number of men injecting drug users who are in recovery, like me. I mean, they stopped using, and they are living clean lives. But the effects of the days that they used to use, they should go and get tested.
71 million people are estimated to be chronically infected with hepatitis C worldwide, which causes nearly 400,000 deaths each year. 257 million people are estimated to be living with chronic hepatitis B. In 2015, 887,000 people died due to hepatitis B. Hepatitis A is common in countries with poor sanitation. People are encouraged to get tested for the viruses and seek medical attention for proper management. Dr. Mercy Korir, KTN News, Nairobi.